So they're trying to bring back the masks now. And you probably heard about Nancy Pelosi. She's trying to get them to wear masks in Congress again, reimposing the mask mandate. And she even called Kevin McCarthy a moron when he said, yeah, this really isn't needed. You're not basing this on science, Pelosi. It's just a political decision. And she didn't like that. So I'm not going to link to any of that. You've probably seen it. If not, you can search for it online. But I want to talk about something that was posted several days earlier to the New England Journal of Medicine on July 21st. Yes, actual science. Gotta love it. And this is a study called Effectiveness of COVID-19 Vaccines Against the B.1.617.2 Delta Variant. Because that's what they're saying. It's this Delta variant. Oh my God, it's this new mutation. It has superpowers and it just gets past all of the natural immunity and vaccine immunity and everything's useless. And oh no, we need to mask up and lock down again because we don't want to give up all the power and control we've given ourselves over the past year. So, not so fast, according to this study. They found vaccines have been found to be highly efficacious at preventing symptomatic disease as shown by clinical trials and real-world evidence. The B.1.1.7 alpha variant, first identified in the UK, was the predominant lineage seen between January and May 2021. Levels of protection against the alpha variant that are conferred by vaccination are similar to those observed in clinical trials, with additional protection against severe disease. Laboratory data indicate that the beta variant has reduced neutralization according to analysis of serum samples obtained from vaccinated persons. Observational data from Cotter indicated modestly reduced effectiveness against symptomatic disease caused by this variant, but high levels of effectiveness against severe, critical, or fatal disease in persons vaccinated with the Pfizer vaccine. And they go on with some other findings, and they say, data on the effectiveness of COVID-19 vaccines against clinical outcomes with this variant have been limited. In this study, we aimed to estimate the effectiveness of two COVID-19 vaccines, the Pfizer and AstraZeneca, against symptomatic disease caused by the Delta variant. And so they're actually using information from the UK, which is easy for them to do because of their national vaccination registry. They looked at vaccinations up to May 16th, including date of receipt and vaccine type, and whether or not they had one dose or both doses, and for the testing about whether or not they actually got COVID. Data on all positive PCR tests between October 26, 2020 and May 16, 2021 were extracted. Data on all recorded negative community tests among persons who reported symptoms were also extracted for the test negative case control analysis. Children younger than 16 years of age as of March 21, 2021 were excluded. Data were restricted to persons who had reported symptoms, and only persons who had undergone testing within 10 days after symptom onset were included, in order to account for reduced sensitivity of PCR testing beyond this period. And they also mentioned that whole genome sequencing was used to identify the Delta and Alpha variants, as well as a second approach, which was the spike gene target status on the PCR. So, normally when you get a PCR test, it doesn't tell you which variant you're infected with. But if you do a special, more specific PCR test, they can tell you that, and that's what they were looking at. The three data sources described above were linked with the use of the National Health Service number, a unique identifier for each person receiving medical care in the UK. These data sources were also linked with data on the patient's date of birth, surname, first name, postal code, and specimen identifiers and sample dates. So I'm not really going into data on all the covariants and the statistical analysis and everything else. You can read through that on your own. Let's just cut to the chase and look at the results. So, how effective were the vaccines? In the any vaccine analysis, in which data from the persons who received either vaccine were pooled, effectiveness was notably lower after the first vaccine dose among persons with the Delta variant than among those with the Alpha variant. Results for the first dose were similar for both vaccines, with an absolute difference in vaccine effectiveness against the Delta variant as compared with the Alpha variant of 11.9 percentage points with the Pfizer vaccine and 18.7 percentage points with the AstraZeneca vaccine. Oh, well, I guess Pelosi's right then, huh? This vaccine doesn't work at all against the Delta variant, huh? 11 whole percent. We gotta mask up for that, right? Well, not so fast. The difference in vaccine effectiveness was much smaller among persons who had received the second dose of vaccine. In the anti-vaccine analysis, the vaccine effectiveness was 87.5% with the Alpha variant and 79.6% with the Delta variant. With the Pfizer vaccine, a small difference in effectiveness between variants was seen after the second dose, 93.7% with the Alpha variant and 88.0% with the Delta variant. The effectiveness with 2 doses of the AstraZeneca vaccine was lower than with the Pfizer vaccine. However, with the AstraZeneca vaccine, the difference in effectiveness between the Alpha and Delta variants was small, 74.5% and 67.0%. So basically it still works if you get both doses. And putting this in context with my previous videos on the subject, remember that if you have a natural immunity, you're going to get the same kind of immunity that you could with a vaccine. And also, if you're like me and you have hybrid immunity, which means you had COVID and then got the vaccine, you're going to have a stronger immunity than you will with either one alone. So all of that means that there should be a strong immunity against the Delta variant. And so they conclude, we found that the absolute difference in vaccine effectiveness against symptomatic disease with 1 dose of vaccine with the Delta variant as compared with the Alpha variant was approximately 12 to 19 percentage points. However, the differences in vaccine effectiveness after 2 doses were small. This was the case with both the Pfizer and AstraZeneca vaccines. A clear effect was noted with both vaccines, with high levels of effectiveness after 2 doses. Vaccine effectiveness against either variant was smaller after the receipt of 2 doses of the AstraZeneca vaccine than after the receipt of 2 doses of the Pfizer vaccine, a finding that is consistent with reported clinical trial findings. Overall, we found high levels of vaccine effectiveness against symptomatic disease with the Delta variant after the receipt of 2 doses. These estimates were only modestly lower than the estimate of vaccine effectiveness against the Alpha variant. Our finding of reduced effectiveness after the first dose would support efforts to maximize vaccine uptake with 2 doses among vulnerable groups in the context of circulation of the Delta variant. So yeah, Pelosi keeps saying, oh, we're listening to the science. No, you're not, Pelosi. Who's listening to the science? I'm listening to the science. Who's got the receipts? I've got the receipts. They asked you, what evidence is there? And your response was to call the guy a moron. And when he asked the same thing of Jen Psaki, her response, well, you don't want to kill Grandma, do you? Come on. How much longer are they going to be able to get away with this? How much longer until the people say, all right, enough. You keep beating us over the head with the science. Well, this is the science. Do this, people. Send this information to anyone you can. Send it to any journalists you can get to listen to you. Send it to your Congress critter and your senators. Write to them. Let them know about this. Let them know that the vaccines work and that natural immunity works even against all of these variants. And we don't need to be going through this. We never needed to be going through this because there was never any sense in which lockdowns and mask requirements were going to do anything. As I've talked about since the very beginning, if we had just gone with the real science, doing targeted protection of the vulnerable and quarantining of the sick and letting everyone else live their lives, we would have gotten through this without all of this mess and without all of the problems caused to our economy and to people's lives by sociopathic and ambitious politicians and bureaucrats who want more control over your lives. Alright, that's it for this video. Comments for the comment god, shares for the share throne, like, subscribe, and the bell, go to donate.bogosity.tv, give in all sorts of ways, including becoming a member at Patreon or Subscribestar. It's the first of the month as I record this, so that means that soon I'll be looking at the AMA, which is what you can do if you give $3 or more. You can ask me a question about anything, and I'll answer it in a monthly video. So watch for that, and if you want to ask me something, just go to Patreon or Subscribestar, donate at the $3 level, and we'll see what everyone has had to say. And of course, there's more great videos and live streams coming up, which you can also see at Odysee.com, which is always monetized, never censored. It's there in the blockchain forever for everyone to see. Thank you very much. Until next time, stay strong and be free.